This is your Dr. K. Samyuktha, consultant urologist and urogynecologist, Srikara Hospitals, RTC Crossroads. So today I would like to bust a couple of myths regarding prostate, mainly prostatic hyperplasia or otherwise known as prostatomegaly. So the first myth that a lot of people ask me is BPH a cancerous condition? No, prostate cancer and BPH are not the same entities. Prostatic hyperplasia or benign prostatic hyperplasia, also known as prostatomegaly, is an age-related condition. Just like graying of our hair, prostate enlargement happens in all men after the age of 50 years. It is a very age-related process, and the rate at which the prostate enlargement happens varies from man to man. So the first myth that prostatomegaly is a cancerous condition is a myth, and prostatomegaly is an age-related condition and not a cancerous condition. The other myth related to prostate is a lot of people think that as the size of the prostate increases, the symptoms also increase. This is a myth because the size of the prostate is not related to symptoms. A lot of patients might have a small size prostate but might be suffering with a lot of prostate related symptoms such as increased frequency of urination, urgency, straining to pass urine, incomplete evacuation of urine, getting up multiple times in the night to pass urine, and sometimes the patient might be having a very large prostate but might not have all the symptoms related to prostate or might be having a normal urinary flow. So the size of prostate is not related to the increase in symptoms or worsening of the symptoms. Another myth related to prostate enlargement is a lot of people think that prostate enlargement occurs only in men after the age of 65. This is also a myth, as prostate enlargement is commonly or generally seen after the age of 50, but sometimes this prostate enlargement can also be seen at a younger age like 40 years in age. So it is not a rule, or it's not a hard and fact rule that prostate enlargement only occurs in very elderly males. Another myth related to prostate enlargement is a lot of people think that as soon as their prostate is enlarged, the only treatment option is surgery. This is a myth, as prostate enlargement every time does not require surgery, or most of the time prostate enlargement does not require medication or does not at all require surgery. There are only special conditions where prostatic enlargement requires surgery. That is, if there is sudden stoppage of urine, which in medical terminology is called as acute retention of urine, recurrent episodes of urinary tract infection, loss of blood in the urine, patient not responding to medications for 6 months or more than 6 months using these prostatic medications, or patient is having a very large prostate with recurrent UTIs, or there is an increase in the post-void residue. These are the special conditions where prostatic enlargement requires surgery. Another myth related to prostate, a lot of people ask that, is prostatic enlargement associated with a sexual activity in a man? This is also a myth, as sexual activity and prostate are not related. Prostate enlargement is a very age related process which is commonly seen in men after the age of 50 years, and sexual activity has no direct or indirect relation with the enlargement of the prostate. But sometimes the medications used for prostate can cause certain problems like retrograde ejaculation, but per se prostatic enlargement has no direct relation to the sexual activity of a man. Thank you.